This is the Governorate of Duhok in the Kurdish region of Iraq. After the rise of ISIS in 2014, Duhok received an enormous influx of internally displaced persons and refugees. Over the past 7 years, the Duhok Governorate has received and hosted more than 600,000 refugees and internally displaced persons. The Governorate rose to the challenge of welcoming those who needed shelter and constructed more than 27 camps between 2013 and 2015. Up to date, 21 of these camps are functional. Today, the great number of new residents continues to put pressure on municipal services. It also means that extra capacity is needed for crisis management, as Duhok is responsible for the safety of an extra around 600,000 persons, as well as its own host community. The COVID-19 crisis brings forth many new and unprecedented challenges. How can Duhok deal with the COVID-19 crisis effectively, and how can we help in sharing expertise? Through its new mechanism CRIT, or Crisis and Transition Support, VNG International supports Duhok with immediate advice on Duhok's urgent COVID-19 questions. Advice is given on distance and by exchanging municipal expertise from the Netherlands on the management of the COVID-19 crisis. CRIT is part and parcel of VNG International's program MASAR for local governments Iraq, a local government resilience program funded by the European Union, and the local government resilience program in Iraq, LOGOReP, funded by the Dutch Ministry of Foreign Affairs. Mr. Wouter Jong is a crisis management expert for VNG International, advisor to numerous mayors and evaluator of the COVID-19 crisis in the Netherlands. Also, he's a lecturer in crisis communication at Leiden University. He is now on his way to the offices of the Association of Netherlands Municipalities, or VNG. From our offices, he will respond to Duhok's 10 most urgent crisis management questions about COVID-19.
Welcome, it's great to see you. We're going to discuss some lessons and practices on COVID-19. Thanks to VNGI for the invitation to share some of the lessons we have from the Netherlands and also answering the questions you send in. Some of you I already met over Skype when we were working on the feasibility study, and I'm really looking forward to share more of the lessons and answering the questions you have. The purpose of this video is to discuss some of the questions you send in related to COVID-19. And I want to share some of the Dutch experiences, especially regarding the crisis communications, share some lessons with you from around the world to answer the questions. But of course, we do acknowledge the difficult situation Duhok and Semel are in. We have no magic stick. Some of the solutions which might work in Western Europe are difficult to implement in your region. We are aware of those things, but we just want to look for ways we can maybe offer you some assistance and passing on lessons from elsewhere in the world, and you can implement in your region. First, the Dutch approach. What we learned, and I think the most important thing was in this crisis, it was crisis communications. And being consistent in all the communications. It was key to tell the people what they needed to do to cope with the situation. More than any other crisis, it was more on instructing the people on what to do and maybe what not to do. So the action part of communication, it was more important than ever compared to other kind of crises. We made use of symbols and infographics in order to explain to everyone what we expected from the people, to wash their hands, use paper tissues, all those kind of instructions. Just try to be clear and make it sure that people will keep social distance and use these kind of communications not only on the website but also on posters, just in the public space, public areas. So make use of the posters, the website. We made use of social media, all the different social media people use. Just try to be in touch with them, communicate with the people where they look for the information. And in the Netherlands, we also share the information in many other languages. I think maybe 7 to 8 different languages we used to communicate with the public. And all those information and pamphlets and crisis communications, you can still find it on the website of the Dutch government, and also in Arab you can find all the leaflets, etc., etc. Maybe that's one of the most important things during such a kind of crisis, and especially a global pandemic. Just don't try to invent it all yourself. Whenever there are lessons elsewhere in the world you can implement and copy, just take it and use it, because only together we can battle this crisis. What we also learned, well, as I say, when you talk about try to communicate with people in the places where the people are looking for information, but that also means in the public spaces. So for instance, also the signs when people go to the park, keep reminding them on keeping the social distance of 1.5 meters in the Netherlands. What we found out is that people are really willing to do the right thing as long as they understand why it is necessary. And I think a strong part of the message in the Netherlands was as well that you don't do it just for yourself, but you do it also for society, for the community as a whole. So whenever you practice all these measures, well, you keep society safe. And that's an important part of the crisis communication message. To stimulate consistency in communication, I mean, it sounds easier than it maybe is, because in the Netherlands we also have all these different layers of government, but we are really working on consistency in the communication. So on the national level, on the regional level, and on the local level, everyone used the same materials and the same messages. And that made it a really powerful message, because then people understood what the government as a whole expected from them. We set up a system of so-called SPOCs, the single points of contact, for all the different government levels, all the different areas, all the different government agencies involved, to facilitate the crisis team, but also have these SPOCs, these single points of contact, at all the different communication departments of all these different government agencies. So everyone knew, okay, this is the main message, this is the key message we want to share with the public, this is what we expect from you, and please pass on this message to the people, to the stakeholders you have. We also used daily newsletters to update the directorates on the developments, so they understood, okay, what are the decisions of today and what is the accompanying communications with it. And we also made a shared document, and you can easily share it, for example, with Google Docs or any other way, but at least have some kind of a centralized document which describes not only the decisions but also why these decisions were made and what it means for the communications with the public. So everyone knows, okay, this is the single shared document, this is more or less the guideline for all the communications for everyone who works for the government on whatever level we talk about. Of course, communication, it's also the power of communications, they used to say, is in repeating the message. Repeat, repeat, repeat. Make it easy to follow the rules and make it easy also to remember the rules. So just stick on easy messages like, okay, keep your social distance, wash your hands frequently, and those just short, simple, action-oriented messages. But we didn't invent everything ourselves either. This is an example you see on this picture. It's a picture from New York, where they made these circles in the park to make it easier for people to keep distance from each other. We saw this example from New York and implemented later on it in Amsterdam and in other towns throughout the Netherlands. So it's easy to use those kind of things. Communicate also that you do understand the hassle, that it is a nuisance to people that you have to keep the social distance and you bother them with wash your hands frequently, but it's really necessary to cope with COVID-19 all the way. So that's but if you show that you understand, it is difficult for people, but it is nevertheless, it is necessary. It makes it easier for people to follow the rule, and they do understand why you ask this from them. So again, communicate it that we are in this crisis all together. And we have to help each other and look after each other to cope with the situation. What worked in the Netherlands, and maybe that's also a development in our public leadership, in the way the politicians talked to society, is that they also acknowledged that there is a lot of uncertainty. Maybe 10 years ago we wouldn't say, okay, we don't know, because, well, from the Prime Minister we expect that he or she always takes the right decisions. But this situation was different because we had this virus and we didn't really know all the ins and outs of the virus. No one knew. So when you share the uncertainty, and as the Prime Minister said, we have 50% of the knowledge and have to take 100% of the decisions, that makes it difficult. But people accepted it. So he said, okay, there's a lot of uncertainty, but this is why I took the decisions, and explained the decisions. And that made it easier for people to understand the situation and how difficult it was, but also how necessary it is to keep all the measures. So that's an important, and that's also the Prime Minister. He had a speech on television where he, more or less, said that it is necessary, but also how difficult the situation was, and the urgency and the uncertainty of the current situation. So that's more or less what we knew from what we learned from the Netherlands from a crisis communications point of view. What we would like to share with you on behalf of VNGI, and now we will continue with the different questions you send in. One of the questions was, okay, but what are these general crisis management and communications measures you took? Well, in the Netherlands, we said, okay, keep 1.5 meters of social distancing, restrict yourself to meet with others outside of your household, outside of your own family you live together with, wash your hands frequently, and avoid busy places. Work from home whenever possible, and we do recognize that it's maybe easier for the Netherlands, where we have all these high-speed internet connections in all the homes. But at least there was an urgency. Please, whenever possible, try to work from home whenever it's possible, and stay at home when one of your family members develops a cough or a low-grade fever. Then it's not only the one who's getting ill stays home, but all the others have to stay home for a couple of days as well, until everything is over again. So those are the main measures the Netherlands took. We had some sort of a lockdown as well, but by now things are easing up again from the 1st of July. But also the government said, okay, we're opening up, but when things are starting to change in a negative way, then we maybe get back to a lockdown situation again. So we are really cautious on all the steps we take. Now to the questions you send in from Duhok and Samel region. There are several topics. First I want to discuss with you question on the economic side, then healthcare, cooperation with stakeholders and the refugee camps, the operational continuity of government, and last but not least, I want to discuss fake news as an item. First, the economic challenges. One of the questions was about how to cope with daily labor, because not everyone can work from home and people depend on a day's week or a week's labor to feed their families. So if you have no option, if you have no other option than to go outside because that's the only way to earn some money, you can have a lockdown, but how do you cope with that situation that people really depend on going outside to get some work? I do understand the difficulty of it, and that it is of course completely different from Europe, where the government gives or provides payments to businesses and people and individuals, self-employed individuals who have no business. They get funds from the government, but of course that's not really possible and it's not really an option in your region. So I think then you have to look for, well, what is the second best option, and that is maybe you should allow people to go outside if it's really necessary. But first of all, you have to realize that maybe COVID-19 amplifies also the inequalities between the workers who are able to work from home, the students or consumers who have the right infrastructure and are able to work from home and benefit maybe also from the challenges and the advantages of the current situation, and the people who really depend to go outside. So if people cannot stay at home, then from a crisis management point or a crisis management perspective, maybe the point is to try to mitigate the risks and do it in a different way. So if you want people to allow to get outside, at least do it in such a way that it minimizes the risk. And there are several options, and again, maybe from countries elsewhere there are other options you can use and you can learn from. These are two examples I found in New York Times discussing two different options that countries in a similar situations as you are found it. One is to have a soft lockdown, so that you do allow people to get outside, but only in their own district. So you try to prevent that people are moving from one district to another. So when there is a COVID explosion again in one of the districts, then you only have to lock down that certain district, but not the entire area. So you try to mitigate the risks by allowing people to get outside, but only in a specific area or a specific district. Another way is, for example, and that's another option, and that's the picture on this slide, that you have, for example, invest in standalone wash stations. So when you are, for example, in a building area where people work outside, the government provides these containers with water and soap, so people can wash their hands frequently and thereby minimizing the risk on COVID again. And you can place these kind of containers, for example, at spots where there is no water available, in certain villages, buildings, or construction areas, wherever it is needed. So the people who are getting outside at least can keep to the measures you want and minimize the risk through that. So the whole trick usually is try to find some simple and inexpensive policies and solutions that can prevent the widespread infection and enable the poor people to work and feed their families. Of course, each country has its own context, so it is difficult for us to say, okay, if you have to do it like this and this and this. But look what are the examples which are available around the world, and just pick the right ones you can implement in your own area. Then on healthcare, there was the question how to balance between people who have COVID and the non-COVID patients, and how do you balance between the pressure on hospital beds. WHO has made some guidelines for that and how to prioritize between patients when you are really running out of hospital beds. How do you take the decisions? Well, for example, you prioritize people who have short stay versus the ones with long stay. So if people have short stay in hospital, you can offer medical care to more patients than when you have a bed which is occupied by patients who stay longer. Maybe people working in healthcare should be prioritized to other people, young versus old. Those are, of course, we do understand how difficult those kind of decisions are, but WHO gives some guidelines in the leaflet I present here in the slide. and has some recommendations on how to use space, how to use staff, maybe also people who had been working in hospitals but are working elsewhere, try to get them back to the hospital because of the crisis situations is really urgent, and you really need even those people who tend to work for hospitals, try to get the supplies from everywhere, and maybe use some areas of the hospital and to rebuild it to more some kind of critical care kind of units. And of course try to lower the burden on the intensive care units, on the intensive care by postponing, for example, the less urgent surgeries. Try to postpone it to later on in the year, and now focus only on the really urgent care you need to offer to people either from COVID or the other care which cannot wait. But then of course the question will be, okay, but what if all the hospitals are full? In the Netherlands we had to anticipate on the situation, but luckily it never happened. So those are of course the situations you don't want to be in, but you have to anticipate on it. What I see from countries around the world is that those kind of decisions on who is going to get the care and who is not allowed to get medical care, in the end most of the decisions are not taken on a governmental level. The governments tend to provide some guidelines, but in the end usually the multidisciplinary teams of doctors they make the final decision, because every patient has a different background, has a different situation. So it's too hard and too complicated to put everything in a guideline. So in the end we ask the experts, and those are the doctors who are working in the hospital, to make the final decisions if you really need to. But what is important is of course that as a government you provide the support and back up the decisions made by those multidisciplinary teams. So if they take this decision, that they know that, for example, the Minister of Health is supporting them in their decisions. Another question was on the cooperation with stakeholders, and especially what the government should do and how they should deal with the status of the IDPs and refugees in the region. To us that's a bit of a difficult question, because VNGI doesn't really know those plans and the expertise which is needed, especially in relation to COVID and the refugee camps. Mm-hmm. What we do know is that the UNHCR has these response plans, and they use for all these refugee camps around the world and also in the region. And they have a lot of knowledge on experiences and the best practices, knowing from the camps from Egypt, from Greece, from Lebanon, Jordan. So they are the experts in this area. So we would suggest to reach out with those people. Maybe again, as I said earlier in this presentation, try to find and to create some SPOCs, the single points of contact, also within these kind of organizations. So you got really short lines to discuss what is needed, what they advise the government, and what they do expect from the local government or the regional government to support them in implementing their response plans under these difficult situations. Then of course, and that's maybe a problem for governments worldwide, how do you organize continuity of government? We are recording this, also our office is not fully packed, maybe just 30% of the people are working in the office. At some of the ministries in the Netherlands, the national government asked people to work from home at least until the 1st of September. But again, we do know that it is easy to work from home over here. And one of the questions was, okay, but how do you plan, what can be a plan to fill the gap when not all the people are capable to be at the office, and some have to work from home and not everyone can work from home. How do you cope with this situation? To guarantee the continuity of government, well, first of all, you have to consider, okay, what are the really critical operations we need without the government cannot function during COVID-19? What are the decisions which need to be in place? What are the critical organizations which are offering or are taking critical processes to maintain in the crisis situation? So if you know, okay, what are the most critical parts of government which need to continue in order to keep society running, then you also know, okay, who are the most important employees who need to be in the office. But not everyone, of course, needs to be in the office to be capable to work. Some can maybe work from home and others who can't. So check with your employees who is capable to work from home, so you have some space left for the people who are not capable to work from home to show up in the office. You can work in shifts. Over here we also have some desks which can be used and desks which cannot be used. You can work in shifts, for example, part of the employees, they work on week 1 and the others work on week 2, and so on and on and on. For the people who show up at work, again, it's the power is in the message and repeating the communication strategy again and again. Display the posters to promote hand washing, sanitize the desks, make it possible for people to sanitize the doorknobs, the keyboards, the telephones they use, and ensure whenever it is necessary that they wear their face masks if it is necessary, use the paper tissues, sanitize everything whenever it's needed and available. For the people who work from home, of course, it is important to stress the point that they need to take some security measures on their laptops or on their computers. Use an antivirus program, otherwise you get from this crisis into another crisis, which you of course do not want. And for the people who work from home, ask your managers to check in with your staff on a regular basis and communicate with them to keep everyone on board and keep them involved. And otherwise you lose the feeling that people are belonging to a team of co-workers. So keep everyone on board and get in touch with them on a regular basis. That's what we can share with you on the continuity of government, but of course again it will depend on the situation and maybe from one ministry to another what you can implement from these lessons. Then another one, and that's the last one, was a question about an issue we know worldwide, and that is how to debunk fake news. Was also part of the feasibility study where people mentioned this part, like, okay, people are sharing all kind of fake news, not only on Facebook or Twitter, but also on WhatsApp groups, and you don't even know where it comes from, but it goes around and people are starting to act upon it. Again, debunking fake news, we do not have a magic stick to debunk all the fake news, but at least it starts with scanning for the fake news. Ask your communication department or communication officer or any other structure you have whenever one gets involved in these kind of Facebook of fake news messages, scan it and share it. So you know, at least as a crisis team, also what is going on and what are the messages people are believing, because, well, their friends or their family members, they share it with them. There are some examples of fake news, like, okay, drink hot water every 15 minutes because that will kill the virus, which is not true. Those kind of messages, try to collect them and make statements on it, and again share it through all the government agencies, like, okay, this is the message to debunk this fake news. Ask the public to help to identify fake news. Make some kind of a game out of it, like, okay, if you know why it's not true, tell us, and we share the answer why it is not true. Ask them to identify it and to understand why it is not true. And that also means maybe a campaign in media literacy, like, okay, be skeptical on the things you read, and maybe you think about it and say, okay, of course it's not true, but think first before you forward it to others and share these messages. And use, I've seen a couple of examples from different government websites around the world where they just have a dedicated website. On the governmental website, there's a special page where they say, okay, these are the rumors which are going around, and this is not true, and they explain also why it is fake, why it is not true. So not only say it is not true, but also explain why it is not true. And maybe you can also refer to other governments who are coping with similar rumors, that, okay, it's not only your own government which says it's not true, but this is recognized as, okay, these are the rumors which go around the world, but it is not true, and this is our advice how to deal with it. Overall, a wrap up. I think, well, of the questions you send in, and also at the beginning, which I share the lessons we had from the Netherlands, I think try to be as transparent as possible and clear about the decisions. It is also strong leadership when you show that you do understand the difficulty of the situation, but it's really necessary to cope with the situation and act and keep to wash your hands, keep your distance, do not visit busy places. But it's also strong leadership when you share that you don't know either what will be the effect of COVID-19, but at least we are in this together, and we have to work together on battling this virus. So you can even share some kind of the uncertainty, but at least it makes you powerful when the people start to believe, okay, they do understand the difficulty of the situation, and that you, like our own Prime Minister, tell them, okay, we have 50% of the knowledge and 50% of the information, but we have to take 100% of the decisions. That's strong leadership in a sense. Acknowledge the uncertainty and explain why you took the decisions you took. That you are being advised by doctors, by medical experts, people who've been studying on this issue, and you use their knowledge and their power to take the decisions, and you can explain why you took the decisions. And focus and repeat the instructions. What do we expect from you to do and not to do? But try to be positive in instructing your public. So try to prevent a bit like what people are not allowed to do, but at least give them the opportunity to think of, okay, but these are the restrictions we have, what is the possibility, what can we still do? We can still meet family members as long as we are meeting on distance, those kind of, so that gives some kind of a perspective that, well, it's a hassle. It's a difficult situation, but you're still allowed to do a lot of things by our government as long as you keep the measures, wash your hands frequently, and keep the social distance. And maybe the most important thing is, in battling this crisis, try to be consistent whenever possible on all the different levels of government, on the national level, the regional level, and the local level. To wrap up with an example from Mexico, I heard that the local governor says, okay, you really need to stay at home, there's a lockdown, don't visit these busy places, you're only allowed to get to the supermarket to do your weekly shopping, but then go back to your home, otherwise we cannot battle the virus. And at the same time, the national president, who is going on an election campaign and gets into the country to visit the crowds and hopes to get re-elected. Those are inconsistent messages, and the stronger and the more consistent those messages are, when all levels of government are all asking the same from the people in the region, I think that's the best way to ask the people to help to combat COVID-19. I wish you a lot of wisdom in this difficult situation, and I'm looking forward to meet you once in Duhok or Smelt. Thank you for watching.